All right. Hello. Good morning, everyone. I'm Dr. Saylor with Every Chiropractic Center, and today we're talking about your skeleton. So just give it a minute for people to jump on. All right. So let's talk about bone health and skeletons in honor of Halloween, which is right around the corner. And I wanted to talk about bones. So once again, I'm Dr. Saylor with Every Chiropractic Center. We're located in Royal Oak, Michigan. So kind of talking about a thing that is near and dear to my heart because most people don't think about their skeleton. So let's talk. Did you know that when you're born with 300 bones? And then by the time you're an adult, you end up with 200 and around 206. So you think, okay, you're born with 300, you end up with 206. What happens? Do you lose bones? Do they disappear? And actually what they do is they start to fuse. So all the different areas that when you're born, the number over 300, certain bones fuse together to form one. Your skull is in 26 different bones. So your skull, your cranium, your facial, and it fuses to make one bone, your skull bone. Your tailbone, which is over here. I'll get this guy. Here's my handy dandy skeleton. Your tailbone itself is basically 5 different bones, and it fuses into one to form your tailbone. And your coccyx, which is your tip of your tailbone. This is the one that people always know, like when they fall on the ice or they fall and they hit their tailbone and they're like, I broke my tailbone. You can actually break off the tip of your coccyx. This bone here is actually in 4 little pieces when you're born, and as you age, it starts to fuse into one. So all of these together fuse to make different areas of your body and fuse to be more of a strong structure. So, but you can actually break off the tip of your coccyx. So mine is actually, I must have fallen when I was really young because you saw an x-ray of me, my tip of my coccyx is not in the best position. So it's in a kind of upward position. So different areas of your body fuse together to form different bones. So let's talk about the point of a skeleton. Most people don't think about it, but why do we have a skeleton? A skeleton is basically a protection. So it's a hard fused bone to protect the soft parts of your body. So skull is to protect the brain. Your brain's kind of soft, so you need a hard shell, a hard natural helmet to protect your brain. The vertebrae are to protect your spinal cord. So that's a hard shell around your spinal cord to protect that, to house your spinal cord, to protection. You think about your ribs. So ribs here, it forms a cage. The ribs, the cage protects your heart, your lungs, your liver. It protects your soft inner organs. So you have a skeleton for a reason, and it's all protection. So let's kind of talk about your skull. It is by far one of the favorite things in our practice because it's one of the things that we look at differently than traditional chiropractic, and we do a lot of work on the skull. So, like I said, when you're born with 26 cranial, skull, facial bones. And as you age, they start to fuse together, and they fuse at these suture points. So all these black lines are sutures. You know, if you were born with a hard, completely fused head, first of all, you wouldn't have a way to grow, especially as you age in your brain, but it's also for the birthing itself. When you are born, so every contraction, if you don't think about it, but what it does is it basically takes the cranial bones and puts them in, opens them up, puts them in to allow a better birth and allow a smaller cranium to go through the pelvic outlet. So every time you breathe, even after you're born, every time you breathe, those suture points are still flexible, which is why the babies have soft spots. So everybody knows about the soft spots, the fontanelle. Be careful, that's not fused yet. And as you age, those areas start to fuse because they're protecting the brain. So for us, I want to talk about this. These bones are really the most important thing because if you think about how many times you've hit your head, how many times have you knocked yourself out, how many times just have you fallen, and you don't think about it, but it's protecting your brain. But all of these bones can actually get out of position just a little bit. We call it cranial sacral in the office. It's a cranial sacral technique. And what we look at is how the brain is affected by these cranial bones. So I have a handy dandy poster here. This talks about the cranial bones and the sutures. So things like the bone that's right behind your eye is called the sphenoid. And the sphenoid for us is one of the most important bones because it actually touches every other cranial bone and articulates with all of them. So for us, if the sphenoid's off, it's going to cause things like migraines, headaches, depression, memory loss. But if it's off on both sides, sleep. You are not getting good sleep if your sphenoid's off on both sides. And that's the number one thing we'll see. Like if someone comes in and I'm adjusting their sphenoids, I'm like, ooh, you did not get a good night's sleep. And they're like, no, how'd you know? It's the sphenoid. And the adjustment's like a magic sleep button to just help you get that deep rest you need. So sphenoids, lots of stuff going on. We're seeing a lot of sinuses right now. So a lot of sinus headaches, and people are coming in, they're like, it hurts right here, it hurts right here, it hurts right here. So if you think about all the different sinus cavities, plus the nasal, if you are having issues breathing, it's your nasal area is not in a really good position. So we can actually gently tap that area into a better position, adjust the sinuses to open them up, let everything drain. So all these different things can cause, if it's off, can cause a lot of the health issues that we're seeing, headaches, migraines, sinus issues, dental. So we do a ton of TMJ because the joint, the temporal bone, is the only actually joint, your jawbone is the only moving joint in your cranium. Everything else is fused except for your jawbone. But you think about it, it is actually like, put this down, it's easier to show you. It's actually like a ball and socket. And we see a lot of people, if you're grinding and you're stressed, you can actually take the ball and socket of your TMJ and pop it a little bit. So your temporal mandibular joint. And by gently adjusting it, it'll relax the TMJ. Okay, so that's kind of talking about the cranial bones. Let's talk about your spine. So most people don't think about it the way we do, but here's your spine. You have 7 cervical vertebrae. So you have 7 vertebrae in the neck. And the vertebrae, let me just do you a little quick anatomy. The vertebrae, remember, the bones in your spine are what protect your spinal cord. Your spinal cord, your spinal nerves, your discs. So this is the vertebrae. This is your disc. These are your spinal nerves. There's holes between the 2 different vertebrae is where your nerves would come out. And then you want a nice healthy disc. So you want, and this is their spinal cord right here. So that's how it protects it. Each vertebrae, move this way, sorry. Each vertebrae can move in 6 different directions. So every time you bend, every time you twist, it can move slightly in 6 different directions, usually in a coupled motion. So it's usually going to bend forward and over, bend forward and back, whatever, you know, basically how you move and bend. So we have 7 cervical vertebrae. Quick fact, did you know that a giraffe has the exact same number of bones in their neck as we do? They're just extremely large. So what we have little bones, they have really big bones. So they have 7 cervical vertebrae too. We have 12 thoracic. Basically the thoracic are what connect the ribs. So every one of these ribs are connected to a thoracic vertebrae in the back through here. And then we have 5 lumbar vertebrae. So we have 5 vertebrae in the back. Anywhere where you bend, like it'll take the brunt of everything. So a lot of people will have disc injuries at 3-4, L3, L4, L5, L4, L5, and into the sacral area, because that's where you do a lot of bending. Same thing with your neck. We see a lot of the injuries at C4, C5, and 6, because that is taking a lot of the brunt every time you bend. So that gives you kind of a quick anatomy of your spine. A couple fun facts too. I'm a big fan of fun facts. So the smallest bone in your body is your stirrup bone in your ear. It's shaped like a little Y, so that's why it's called a stirrup, and that actually helps you with hearing. Your largest bone and your strongest bone would be your femur head, so your femur, because it's the largest bone. It's also the really, really strong bone. And more than half of the bones in your body are actually in your hands and your feet. So you have 206 bones in your body, and 106 of them are in your hands and feet. So if you think about how many different bones you have in your feet alone, this is your foot, every one of these bones, every one of these areas can be in a misaligned position. So we adjust feet nonstop all day. I have a friend that was like, oh, what do you wear to adjust in? I'm like, pants, because we're sitting on the floor nonstop adjusting feet. Because feet, we see so many people with foot pain because any one of those bones, if you have this many bones and ligaments and tendons, any one of them can get in a poor position. So 106 in your hands and feet alone. Most people have 12 ribs. We do have, there's a number, like there's a 1% of the population has a 13 rib. So who would have thunk that? And then your bones are really strong, and we want to keep them strong. We're going to talk about tips to keep them strong. But did you know your teeth are actually stronger than your bones? So the enamel of your teeth are stronger because they, first of all, they have to protect the nerves that are in your teeth, but they're actually stronger than your bone. So let's talk about kind of ways to stay strong. A lot of these tips most people know, but you don't think about the body you live in right now. The body you are right now is the only one you have. So you need to take better care of it. So things like bone-friendly diets, so eating fruits and vegetables, is going to really help with strengthening your bones. Calcium. Most people think about calcium and they think about milk, but we really want to talk about like the food that you eat that help with better calcium and better absorption for bone density. So things like kale, things like spinach, things that are going to give you more natural calcium. Vitamin D. Vitamin D helps calcium absorb. So you actually need both to keep your bones strong. Sunlight is the number one thing. Right now we're going into winter in Michigan, and sunlight is just not going to be there as much as we need. And I think we have daylight savings times coming up. So we really want to focus on how you're going to get more sunlight into your body and how you're going to get more vitamin D. Salmon is going to help some of the vitamin D heavy foods, and also supplements for both. So a good calcium supplement, a good vitamin D supplement is going to really help with your bone density. Movement. So exercise. Weight-bearing exercise is going to be the key to keeping your bones strong and healthy. Women, and there's studies on this, that women that exercise later in life make a huge difference in how strong their bones are. You don't think about your body being strong, but you're also helping your bones be strong. So things that are going to have impact, walking, running, things that are going to cause bones. Let me back it up. So most people, when you exercise, you know I'm exercising to be healthy, but when you exercise, it's actually breaking things down so your body can build things back up. So weight-bearing exercises that impact exercise, using actual weights to make your muscles stronger, are going to help your bones stay strong too. And this is one of those things that you start young, but the older you are, the more important weight-bearing exercises, actually using weights. We stress it in our practice here with our older women that that's the number one way to keep your bones strong and healthy. Exercise is the key. And then quit smoking. Seems like I shouldn't really have to say this, but smoking actually leaches your bones, leaches the good stuff from your bones. So that is, I know it's the hardest thing to break, but it's the best thing you could possibly do for your body. Watching salt, watching alcohol, it's those tips that you know. But protecting your body. So, you know, this seems like a no-brainer, but playing sports, wear a helmet. Riding a bike, wear a helmet. Riding a motorcycle, wear a helmet. My motorcycle, like I see people with no helmets riding motorcycles, and it just freaks me out because your brain is the most important area, and you fall. Oh, okay, off my soapbox with that. But we actually see more injuries from soccer than we do from football. So let that sink in a little bit. Football players wear helmets, they wear pads. They're taught how to hit correctly from the get-go. My soccer players don't wear helmets, they don't wear pads, and they're not taught to hit even though they hit. So we see way more injuries with our soccer players than any other sport in our practice. And it's just because they're not wearing protective gear. So protect your body. My kids were the ones that wore the elbow pads, and they wear the knee pads when they're roller skating because I want them to be protected. They're not allowed to ride anything with two wheels if they don't have a helmet on. That's just how we roll in our practice and in our house. Last but not least, it's one of those things that you don't think about, but get adjusted. So chiropractic is going to make a huge difference in keeping your body healthy, keeping your bones strong. Because when you think about it, and most people don't, so we just talked about movement being the key to how your body functions and how it stays healthy. every time you bend, every time you move, it actually opens up the space, allows fluid to get into your disc space, allows the body to absorb, increases circulation, increases like the disc health. So this is a nice healthy disc. And everybody has heard of arthritis and herniated discs. I'm going the wrong way. Okay. So this is arthritis. Bone is laying down more bone. You can see that it's jagged. You can see that this disc itself is not healthy. It looks dehydrated. It's not in a good position. And what it allows is the body to start rubbing down. So it's allowing the bone to wear down and start to rub. That's actually what arthritis is. It's bones laying down, rubbing, rubbing, rubbing. If you have two things that are rubbing together, it's going to wear down. So we want this. We don't want this. So there's the difference between a healthy vertebrae, healthy disc, and a not so healthy spine. So back to that, why chiropractic makes such a difference. Chiropractic, when we talked about those 6 ways that each vertebrae can move, they can get in a misaligned position on any one of those 6 ways too. And we want the body to be moving. We want the bones to be moving. We want everything to be flexible. We want circulation. We want blood flow. Most people spend way more money and time on their teeth because they can see their teeth. You can see when someone's teeth are crooked. You can look at someone and say, hey, I think you need braces. You can tell, but your spine, because you don't see it, you don't think about it. You would never say, hey, your body's crooked. You can see it on an exterior representation, but you just can't see what's going on the inside. And that's where chiropractors make such a big difference in overall bone health and overall healthy living. So that being said, if you have a chiropractor that you love, call them, get adjusted, get on their schedule. And if you don't have a chiropractor that you love, we would be happy to be your chiropractor. This is what we do. We do a ton of cranial work here in the office. We do a lot of stuff. So if you're sitting there thinking like, yeah, you know what? My feet do hurt. Oh my gosh, my hands do hurt. I have a headache. I have sinus issues. That's what we do. We use a very gentle technique here. It's a gentle tapping technique that makes a difference with no cracking or popping. But we do a lot of the cranial work that we talked about, which directly affect your brain, affect your migraines, affect your headaches, affect your sinuses, and can make such a difference in keeping your bones strong and healthy for the rest of your life, because you only have one spine. This is it. Take better care of it. So if you have any questions, please call us. We are happy to help, and share this video with your friends and family. So we hope you have a fabulous day and enjoy the bones and the scariness of Halloween. So have a wonderful day, guys. See you later. Bye.